Me and Arlen, we were so close. We were together all the time, basically.
In this story, everything begins with a promise.
I couldn't let her down. And I promised my sister when she was dying that I would look after him. So I took on that responsibility.
Thanks.
Marie now cares for her sister's son, Stephen, 7 days a week.
What are you putting on?
Like 3.
Ha ha.
But in 3.5 years, she hasn't had a break. The 2014 Care Act made many promises of its own. One of the key vows was that unpaid carers would get some respite.
All I've asked for off the social services is to try and give me that break. The 1 week here or the 1 week there. And as I said, in the past few years, they've not been able to do that. I'm not entitled to respite because I don't actually live with Stephen. So he gets down in the dumps because obviously he doesn't go anywhere. He's not asking for a week in Barbados. He's asking for a week in Southport. I need the break as well. I need that rest. He needs that rest. I need to recuperate. I need a lie-in once in a year at least.
Marie doesn't want to leave Stephen in a care home. She says he's young and wants to talk and socialise with people rather than just go watch TV in a small room. But the council won't fund a respite break, leaving Marie, like millions of other carers, feeling overwhelmed.
I can't imagine ever being okay with myself if he went into a nursing home. I would hate that. It's like putting him into prison, throwing away the key. I just feel completely ignored. I feel like because you're family, they know that you will stay here and do what needs to be done. They know that. I can't just walk away.
A spokesperson for Liverpool City Council said,
"We are actively supporting Marie and have arranged a social work visit to discuss respite options and also to review Stephen's care and support needs. The council is committed to supporting carers and provides respite care to meet individuals' needs and circumstances."
More than 200 miles from Liverpool and a world away from Stephen and Marie, it's funding decisions made in Whitehall that dictate how much English local authorities get to divvy out on respite as part of the social care grant. But do we really know how the government decides what it spends on this vital support? Campaigners say critical data is being kept secret. But now, in a landmark case, the Treasury's calculations could be made public for the first time ever.
This case matters because it speaks to the heart of government transparency. It's simply not good enough for government to say that they are adequately funding social care when all of the other evidence out there seems to contradict that position.
Carrie Gerstheimer says this case would expose that funding gap, problems with the data, biases, and even unmet need.
That's the absolute crux of this case. We're trying to understand how much money is needed to actually fund social care.
Why don't we know this? Why is the government keeping this secret?
Government are saying that they need privacy in order to make public policy decisions.
Do you buy that?
I don't buy it. I think that...
Does the Information Commissioner buy it?
And the Information Commissioner doesn't buy it either. The Information Commissioner has held that it's in the public interest to disclose this information.
Now, within weeks, it'll be up to a tribunal to decide whether Treasury gets to keep its secrets. Over 400,000 people are waiting for assessment, care or support. And those waiting more than 6 months have increased by an incredible 99%. Plus, just 6% of social care bosses are confident they can meet their legal duties.
So the social care system is really, really struggling. It has been for some time. Funding for the system has not kept up with the pressures. Many people go without the care they need. Unpaid carers are under huge stress.
The Health Foundation says just to continue to muddle through, within 8 years, the social care budget will have to increase by £8.3 billion just to meet demand. It will need an additional £10 billion to help people who are currently falling through the net and ensure care providers don't go bust. The Department for Levelling Up Housing and Communities told this programme,
"We know councils are seeing increased demand for adult and children's social care services. That's why we have given £500 million of new funding. This new funding means adult social care expenditure has increased in both cash and real terms year on year since 2015.
But the needs of many remain unmet.
It's hard. It's hard when you're caring for people. Your life is stopped, basically.
Despite all this, Marie has kept her promise to her sister. The question is whether in the current stormy financial weather, the government will stick to theirs.
And late this afternoon, Liverpool City Council added to their statement on Marie's case, telling us a social work visit has been arranged to discuss the current support options available and also to review Marie's nephew's care and support needs, including his contingency plans for when his aunt is on holiday. We acknowledge there have been a number of social workers involved in supporting Marie's nephew over recent years, and we apologise for this.